from Heal at Home Pet Care, and today we are going to go over the basics of CPR for your pet. So if you come across your pet is in a situation where they seem to have stopped breathing or they've collapsed and you're not sure what to do, we'll go over the most important things that you need to remember in a crisis. And CPR is the same thing, it's the same basic premise in people as it is in pets, but it's a little bit different. And they're treated more like children or babies when you're doing the actual CPR procedure. So if you find that your pet is collapsed or unresponsive, the first thing to do is to check if they are breathing. And what you'll do is just take a minute and watch and see if their chest is going up and down. And for some pets that might be a little difficult to see if they have a lot of hair, if they're breathing very shallowly, and if they're not breathing consistently. The other thing you can do to see if they are alert and aware and conscious is if you take your finger and you give a little tap on the inside of their eye. If they have a blink response, then most likely they're conscious and they're probably breathing and they have a heartbeat. So if you determine that your pet has stopped breathing, you want to determine if they have an obstruction in their trachea, and in which case you would have to do a Heimlich maneuver. So that is similar to people also. You can hold them up on their back end and you hold under their ribs and you give a push and thrust so that you're forcing air through the trachea to force any objects out. The other thing you can do, you don't want to get bit, but you can also open their mouth up and you can do a little finger sweep and just see if there's anything in there. Just be careful because many pets will not allow this. The best way to open a pet's mouth if you need to get in is to take their gums and you push them underneath their tongue, and that way they don't bite you and they open their mouth easily. Sorry. So once you've determined that there's no obstruction and your pet is still unconscious and they're not breathing, you want to check for a heart rate. And to check the heart, it's right where Lavinia is pointing out, right there. When you bend the arm, it's right where, it's actually on the left side, it's where the elbow meets the chest. So right in that area, you're going to put your palm and determine if there's a heartbeat or not. The other places you can check for pulses, if you're skilled at it, are inside of the back leg. But I think in an emergency, most people are not skilled at doing that. So you can check for a heartbeat quickly. If you have a small pet like Paco, you can put your whole hand over the chest. You could put your ear to the chest and listen. But time is of the essence also. So if they're not breathing and they don't have this eye reflex and they really look like they're not conscious, what you want to do is start moving air in and out of their body to get their heart going. So there is a concept of the ABCs of CPR, and that's airway, breathing, and circulation. But that model has changed in human CPR, and it's also changed in animal CPR. So instead of doing airway first, and you do want to check if the airway is open, if you're in a hospital setting, what they'll do first is put a tube in the airway and they start pumping oxygen in, but you're not able to do this if you're outside and you obviously are not a medical professional, so you're not going to have a tube available. So the second thing is the breathing, and that is you're checking if they're breathing coming from their lungs, and if they're not, you're going to start compressions. And what this does, this is the most important part of CPR, even in a hospital setting. So you're going to start compressions at the chest, and let's scoot over. Okay, and the best thing to do is if you can put your pet on their side. Obviously they'll be unconscious, but you'll put your pet on their side. Lavinia is going to help, and right at the level of the heart, where the elbow meets the heart, you're going to do compressions. And the goal is to compress the entire chest and heart area, and you have to imagine that you're squeezing the heart. So what you'll do is support the back and put your palm over the heart, and you will do compressions. And obviously I'm not going to press down on Paco, but you go a little bit more than that. So you give a little bit of compression. You don't want to do too much, you don't want to break any ribs, but you don't want to do too little. You have to get into the heart area. So if you have a very large dog or something like a bulldog with a barrel chest, you'd be doing this procedure with them on their back. Here, let's show everyone. So you'd be doing it this way instead of on their side. Okay. And the most important thing to remember, so what this is doing is you're pressing on the heart, so you're getting circulation going, and you are moving air in and out of the lungs as you do this. So you're getting the A and you're getting the B because you're moving the lungs, so you're getting the breathing. And then you're also getting the C, the circulation. So this is the most important part of CPR. If you have a second person, they can breathe into the mouth and the nose, and the way to do this is you would just give a little breathe into their nose. So you would continue these compressions as long as you can. And in medical CPR, after 2 minutes, the medical professionals swap to a new person, because even though that person doing the chest compressions feels like they can keep going, in studies they found that they start tiring out and they're not doing as good a job. So 2 minutes, if you're the only person there, then you have to continue doing it. But at 2 minutes, you would also check and see where you're at. You would check and see if there's a heartbeat. You would check and see if there's any breathing going on. You would check and see if there's an eye reflex. And if you see any of these things coming back, you can stop the chest compressions and reevaluate where you're at. There's another thing that you can do to get the breath going, and it's an acupressure point. And it's located right where the nose and the mouth meet, and there's like a little X area, and right here is an acupressure point that when they're unconscious you can just press straight in, and that can stimulate breathing. So that's another good thing to know. When you're doing CPR in a pet or any kind of medical procedure, when they're hurt or when they're unconscious, you have to watch out. You don't want to get bit in the process. If the pet's unconscious, when they wake up, they won't know where they are, they might bite, they might not truly be unconscious, and they may just snap if you touch something that's broken or hurting them. So you want to be careful. So the way to do this is if you have some kind of a towel, if you have a shirt, sock, something to protect, and either what you can do is you can wrap it around their mouth like this, or even if you have just a big towel, just something like this, and what it does is if they do go to snap at you and they look up, at least you're protected in some way. But usually having like a little muzzle area is good. It's also good to have a towel or something if there's any bleeding or anything like that and you need to put a stop to it. You can put a tourniquet on them until you can get to an emergency facility. So I hope you never have to use the CPR skills, but if you do, just remember the best thing to do after you assess that you need to do it are the chest compressions. And I hope this helps you and your pet if you ever get into an emergency situation. Okay, see you soon. And be sure to watch the other videos of checking your pet's vital signs so that you can link all this together and come up with an idea of how your pet is doing. Okay, see you soon.